Hello, it's Dr. Rhonda Johnson. Today is Tuesday, March 1st, 2022, and today I'm talking about Year 3 March Pandemic Reflections. You know, as we usher in the month of March today, I cannot help but look back on how this pandemic has evolved in the past year. So this message is my reflections. Now, first, I want to recall two important dates. March 11th, 2020 was when the World Health Organization declared COVID-19 as a pandemic, and March 13th, 2020 is when former President Trump declared COVID-19 a national public health emergency. So looking back during the first year of the pandemic in March of 2020, the only tools we had to avoid the spread of COVID was changing our behavior. We wore masks, we socially distanced, we drastically reduced our indoor gatherings, we washed our hands, and we avoided unnecessary travel. Then came the vaccines, the monoclonal antibodies, the standardized treatment regimens, and we tried to go back to what our previous normal was in 2021. And then came the variants, Delta and Omicron, which showed the limitations of our healthcare system and the limitations of the effectiveness of the vaccines in terms of preventing infection. Now, some experts say to end this pandemic, folks, we have to change our behavior. Behavior change experts say to change our behavior, we need to make it easier for people to do what we ask them to do. Well, there's competing messages, and people only listen to people that they trust these days. And many people in our country and throughout the world are in full-blown COVID denial. They say it's over, and they even deny the reality of long COVID. Misinformation remains rampant. Then there's behavior of this virus. Variants such as Omicron can get totally out of control extremely quickly. So as we enter into the third March since the pandemic was declared, we still face a lot of uncertainty. We don't know what will be the next variant of concern, how severe it will be, or how contagious. We do know that Omicron subvariant BA2 cases are doubling here in the United States. And I'm not saying what's happening in Hong Kong will happen in the U.S., but just take a look at Hong Kong. Currently, cases are exploding. The city's morgues are at full capacity, and they're having to build makeshift hospitals in fields. So I remain cautiously hopeful in the third pandemic march. Hopeful because we have high levels of population immunity, and we know more about this virus. Our tools are better, but we still have to keep our behaviors in check, folks. And we have to watch out for the vulnerable, the young children, the elderly, people with disabilities, people who work in essential services, our healthcare workers, people who are incarcerated, people who have lower incomes, and people of color. I'm cautious because none of our tools can change people's behaviors. Misinformation, opposition to public health recommendations will continue to have deadly consequences if we can't figure out how to change this element of our human behavior. That's my message today. As always, my views are my own. Stay safe and enjoy March safely.